My name is Dr. Janelle Hadley. I am a second-year resident training in family medicine.
And I'm Dr. Pete Thomas, and I'm an internal medicine physician and director of the HIV program here in Chicago.
Today is National HIV Black Awareness Day, and so we're just here to have a really good conversation to help facilitate things that are going on in our community, how things have evolved and changed regarding treatment. So I can actually start with the question to Dr. Pete here. And I want to know, we were talking a little bit more before, and we talked a little bit about your experiences through your training. And I just want to know a little bit, if you could share, how the treatment has changed over the course of your training.
So that's a great question. And just to start, when I began my training back in the late 90s, 2000s, HIV was essentially a death sentence. We had antiretroviral medications to treat HIV, but they were very heavy on the side effect side and not so much efficacy, which means, it worked kinda to suppress the virus, but would eventually develop resistance. And then you had all these side effects that came along with the medications. And so patients would take 15, 12, sometimes up to 18 medications. And they would have nausea, vomiting, headache, dizziness. And I don't mean one or two of those, but all of them, And then you can imagine having to take those medications every single day, and then to have maybe 60, 70% effective rate. So now you oppose that to what's going on now, where we have a single drug, a single tablet that has 3 different medications in it, that has an amazing amount of efficacy, provided that there isn't resistance. It's just great. It's night and day, literally, with a very, very low side effect profile. So in any medication, as you know, that's your ideal goal. Your ideal goal is to have the maximum efficacy and with the least amount of side effect. As you share with your patients, like I do with mine, there's no such thing as no side effect. Right. So, I try to have managed expectations with our patients, right? You have to let them know there is not a drug that does not have a side effect. And the question is, what side effect can the patient tolerate? Yeah. So that was then, and this is now. And now has allowed us to really begin to have a real conversation about ending the epidemic. And so when the federal government, particularly the Department of Health and Human Services, says the mandate is now to end the epidemic by 2030, that is a real goal. It's not make-believe, it's real. And there are certain mandates that programs and hospitals that are getting federal dollars, particularly Ryan White dollars, that they meet certain metrics in order to ensure that that goal happens. And I'll just give you an example. Like, they want a certain percent, like let's say 80% of your patients have to have viral load suppression. Okay. Meaning anything below 20 is what most labs calculate. So they want your viral load to be less than, they want 80% of your patients to have a viral load less than 20. They want a certain percent of retention rate, which means the patients to have to come to visit at a certain time interval. Because those things are tied to, they can be extrapolated into eventually having a real discussion around ending the epidemic. And so there's a commonly used phrase called U equals U, undetectable equals untransmittable. Something that we discussed earlier, and I like to use this, it's called the HIV Continuum. And it says basically there's 1.1 million people in the United States who are infected with HIV. Okay. Only 86% of those folks are aware of their diagnosis. Of those, only 44% are actually engaged in care. Of those, only 37% are on these highly effective medications to treat HIV. And then of those, only 30% is actually virally suppressed. So you can imagine the tall task that we have. If only 30% of the people are virally suppressed, don't forget, U equals U. Undetectable equals untransmittable. So really the only people that are undetectable are the people that is that 30%. Which is the reason why the federal government says, hey, if you're getting Ryan White dollars, we want 80% of your clients to be undetectable. And so that's really pushed programs not to be tolerant of people who, I didn't take my medicine, or my insurance lapsed, and you have to push. You want to keep getting these dollars. You need to make sure that your clients, you do whatever you have to do to make sure your clients are taking their medication and that they're responding to those medications. So that means checking them back and say, hey, we had you on 6 weeks of this medicine. Let's check your numbers again and see if if we've gotten your viral load down to 0.